So is this set to go, or do I have
It's already running.
running?
Yeah. We got an 8 gig memory card out, so that should last for as long as...
Okay.
That 8 gig memory card should give me about 4 hours record time. Did you see anything unusual?
Cortical changes on the spine.
5 cc's marking with 1 cc dexamethasone. He's recording first. 5 cc's marking with 1 cc dexamethasone and a 3 cc marking.
Oh my goodness.
Actually, if you see that it turns out nice, the recording, and if you can edit it in a way that you don't lose your privacy, it'd be nice if we had like a 15-20 second clip or longer that we could show patients that have never had a nerve block.
Sure.
Because they always wonder, oh, how is it? Am I going to be like, you know, screaming in terms of pain? But if we have a video of somebody actually getting it, then it's
Yeah,
it is
no problem. I'd be happy to.
because I think yourself, even you didn't know what to expect, kind of maybe the first time.
No,
To
didn't.
some extent.
And quite frankly, I don't like the needles, but
Yeah.
hell, I know anybody who does like needles.
Oh yeah. Some people are quite phobic, but you know, as long as you're not phobic.
Old girlfriend of mine took her to medical lab to get some tests done.
Yeah.
I'm sitting there in the waiting room. They called me. They asked me to come in. She's sitting there frozen in the chair.
Yeah.
They wanted to draw blood. I
Right.
said, okay, I'll hold your hand, whatever. I'm standing there holding her hand, petting her head, and all of a sudden I feel teeth.
Oh, she was biting it.
She was biting my arm, and she didn't stop biting my arm until they pulled the needle out.
This is before you were married, or you're hanging around with the old
Before
you're married.
before
Sometimes people still hang out.
No,
I'm gonna find out what worked on that.
that, well, not only that, but, I have to admit, looking back now, I wonder why I ever went out with that
Oh,
girl.
is that right?
Oh, no, I'm not saying there's anything wrong with her, it's just that,
I'm fine.
we didn't have very many interests in common.
What can we do?
I mean, yeah, an interest in sex is great, but,
Maybe more than that, yeah.
you know, she spent most of her evenings watching TV. Whereas I liked, doing things. Intelligent conversation is a,
Yeah. Okay, so you're gonna do just the last injection down into the sciatic nerve area. And do you want to continue monthly or every 2 weeks, or what do you want to do?
I'd like to try it every 2 weeks. The last time it only lasted about a week.
Okay. So we'll see you in 2 weeks. The medication has been given for 1 month. If you are feeling good and you want to put it off, then try to give us a few days
call them and
notice.
say,
Yeah.
okay, yeah.
Try to let us know at least 2 days in advance.
Yeah, my wife told me that after her first nerve block, it only lasted about a week, but the second one lasted longer, so.
Yeah. And this one does have cortisone. She probably has never had the cortisones.
I don't know.
She was getting them for migraines, was she?
Yes.
And where was she going again?
Dr. Goldstein across from York Central.
Yes, yes. So is she still getting them, or is she better with it?
She's still getting them. They had to go back to the earlier phases because she was at a warehouse where they had forklifts.
Oh, okay.
And the carbon monoxide brought on a migraine attack out of nowhere.
Oh.
But for like, was she getting them when she was like once a month, or?
She'd gone down to once a month.
Oh, she had gone down to once a month, yeah.
From once a week.
Once a week.
Okay, so I can get up then?
Yeah.
Yes,
yeah.
give it over.
Yeah, and so we believe it was the carbon monoxide from the forklifts that caused the.
Okay.
And since I used to design catalytic converters for forklift engines, and the company that made the forklifts that were at that warehouse is one I've dealt with, and I actually know what their catalyst composition is. I have, you know,
Yeah, suspicion that was it.
it could have been it could have been some of the hydrocarbons, but I have a suspicion it was carbon monoxide myself. Of course, with that sort of thing, you can't really prove it.
No.
Especially when the amounts were low enough that nobody else that was in the building was being bothered. So.
Okay, so see you in 2 weeks then.
Yep.
Take it easy.
Thank you, doctor. Have a good day.